Good morning, everyone. My name is Tiana Brown, and welcome to today's webinar, COVID-19 Vaccinations and Childcare Providers. Before we get started, I would like to go over a few items so you know how to participate in today's event. When you join today's webinar, you selected to join either by phone call or audio. If for any reason you would like to change your selection, you can do so by accessing your audio pane in your control panel. The webinar is being recorded. All participants are placed on mute for quality assurance. You will have the opportunity to submit text questions to today's presenters by typing your questions into the questions pane of the control panel. You may send your questions at any time, and we will collect these and address them during the Q&A sessions throughout and at the end of today's presentation. I would now like to turn it over to Kathy Glazer, VECF President.
Thank you, Tiana, and good morning to everyone. Really glad that you have all been able to set aside some time today to talk about a conversation and a subject that's extremely important to the Commonwealth. We'll be talking today about ensuring supply and access to COVID-19 vaccinations for the childcare industry and early childhood educator workforce, as well as addressing issues around factual information about the vaccine, the risks and the benefits, and being respectful of some of the concerns or vaccine hesitancy that may be going on, and just have an honest conversation about ways to consider that. We are really pleased today to have a number of speakers who will be sharing information and hearing feedback from you all on these topics today. First of all, we'll be welcoming First Lady Pam Northam, who has been probably the most vocal and visible supporter of childcare and early educators over the last few years. We'll hear from Secretary of Health and Human Resources, Dan Carey. Then we'll hear from a physician and an RN about their considerations and suggestions around vaccination for this population. Then we'll hear about an exciting new collaboration effort among the administration, the Department of Health, local health departments, VECF, Smart Beginnings, and other local early childhood partners. And David Carey and Shekinah Mitchell will be sharing information about that. Then we'll also have a few minutes to talk about how early childhood educators, employers, childcare operators, et cetera, can consider how to handle and manage the issues around vaccination for their staff team, with some suggestions about best practice, as well as some ideas for education, encouragement, et cetera. And so with that, I am just so pleased to begin with welcoming Virginia's First Lady, Pam Northam.
Good morning, everyone. Thank you, Kathy. We're just so appreciative to you, to the VCF team, to all of our early childhood friends out there who have come together to make this happen so we can care for each other right now. I'm so grateful to Secretary Carey and his team at the Department of Health. Oh my goodness, working round the clock. So hard to get vaccines out to everyone in the state, and who jumped right on it when we said, hey, we have to take care of those who care for us, our early childhood community, and they were right there working hard to put this together for you. To our partners, the navigators out there that we're calling them, my goodness, we said, you know, we need some help to get out there in the community, and you once again stood up and said, we're here, but let's do what we can do, let's work together, and I love that about this community. And thanks to each and every one of you out there in the early childhood care and education community. You know, I've been your biggest advocate for so long, traveling over 6,000 miles across the Commonwealth to say what superheroes you are, what an amazing job you do that's so important to the every working day of the Commonwealth. We so appreciate you now more than ever before. And you all, from the very beginning of this pandemic, again, jumped right in with both feet and held the line. You courageously and creatively came up with every challenge we threw you throughout this difficult thing, as we all learned together how best to protect ourselves and our families. You kept your doors open and took care of our children so that they were healthy, happy, and learning during this whole process. And that is huge. And we are so very grateful. Over 80% of you still out there open and helping all of us today, all of our families. And we're just so very grateful. It's easy for some people to stand up for a little while and do something extraordinary, but you are there day after day, providing that consistent loving care and education for our children and for our families. And that's going to make all the difference in how we recover from this terrible pandemic. So thank you so very much. We can see the light at the end of the tunnel now. All these amazing people that you'll hear from today are working hard because they care about you. Please get the vaccine when it's your turn. It's safe and effective, and it will help us all to get back to where we need to be and our children safe and moving forward in the future. So thank you again from the very bottom of our hearts. The governor and I see you. We appreciate you. We know the extraordinary work that you provide every day, and we're so grateful. So take care of yourselves and each other, and I look forward to getting back out there on the road and seeing you again soon. Take care, everyone.
Thank you so much, First Lady, and you have been so good to spend many hours and go many miles to actually be in person on the ground and visiting in these sites. And I know it's appreciated, and I think we all look forward to a world where we can do that more frequently in the future.
Thank you, dear. I've got lots of books to read. I need to get back out there.
We look forward to it. Thank you so much.
Thank you.
And now we're going to turn to Secretary Carey. I know this, the whole business of vaccination rollout has certainly been a huge chore that you probably never dreamed that you would be doing. And I think, we'd love to hear from you about some of the bumps along the way and sort of, what an extraordinary operation this is, as well as hear from you about the commitment of the Commonwealth to the child care industry, as well as maybe some bumps in the road that we've observed, and your commitment to making that more smooth.
Well, thank you so much, Kathy. Can you hear me okay?
Just perfect. Thank you.
Perfect. Great. Well, thank you, Kathy, and thank you to the Virginia Early Childhood Foundation for asking me to participate, and thank you for the great leadership that the First Lady has provided all along the way. And my job today is to give a short review of a Commonwealth's vaccination rollout, and I'll get right to it. The vaccine summary dashboard on the VDH website continues to show Virginia's significant progress in vaccinations. As of today, Virginia ranks 7th amongst all states for percent of the population that has received at least one dose, and 11th among all states for percent of available doses administered. So we've made great progress, and we will continue to improve day by day and week by week. All health districts currently have clear information on their websites about vaccine eligibility and how eligible individuals can pre-register online or by phone. A new statewide pre-registration system will launch next week, and actually it's launched in a quiet launch internally, and it's this week, and it will be publicly announced and go live next week. And this will improve the consistency of the process and allow individuals to confirm their pre-registration status over time with both incoming and outgoing messaging. And assistance is in English and Spanish, and then access to over 100 languages should the need arise with a quick callback. So that is at the call center 1-877 ask VDH3, but that will be migrating to a new number. You can still call that number next week around vaccinations, and a lot more to come on that. And new representatives are being trained to exponentially expand our call center capacity and to build on the capacity available in localities as well as in local health departments. And this will ensure that all callers get timely assistance with questions as well as pre-registration for vaccines. And yesterday alone, approximately 7,500 calls. Those 75 and older go to the head of the line, but the wait time was less than a minute for all callers. So, and that is, and we will be tripling the number of attendance in the next week. So we're really excited about this new statewide capability to assist local call centers. And based on our population, Virginia receives approximately 129,000 doses per week from the federal government. And while this is up 23% from the 105,000 doses per week we were getting in the first 6 weeks, the increase for each of our 35 health districts here in Virginia is relatively small. All states rely on the federal government to distribute vaccine doses by population, and the pace of incoming doses is not expected to increase until March. So the doses Virginia receives from the federal government are allocated to the Virginia Department of Health to local health districts. So they're actually sent by UPS, by FedEx, directly to those addresses that are designated vaccination sites and vaccination partners from the local health districts, and primarily in proportion to each district's populations. And local health districts are expected to determine the most equitable and efficient use of each allocation, leveraging any combination of their own staff and volunteers, hospitals, pharmacies, the capability of the localities with their emergency management staff and others, as well as individual providers. And additional doses help support targeted equity initiatives. And other doses reach some residents in Virginia through separate federal allocations through the VA, the Veterans Administration, the Department of Defense, or through the Bureau of Indian Affairs, to name a few. All local health districts in Virginia are in phase 1B of vaccine eligibility, and this means that approximately 50% of Virginia's population is now eligible. And other than healthcare workers and residents of long-term care facilities who are in phase 1A, the Virginians in phase 1B are at the highest risk of exposure to COVID-19 or serious illness if she or he becomes infected. So teachers and childcare providers, both public and private, are prioritized in the upper echelon of phase 1B. So while local health districts are allowed flexibility in how doses are administered to eligible individuals, roughly half of the available doses should be used for people age 65 and older, because they have borne in terms of serious illness and unfortunately losing their lives to COVID, that is where approximately 75% of Virginians in terms of age above 60 has been the highest risk group and above 65. The other half should be used for frontline essential workers, people with high risk medical conditions as identified by the CDC, as well as people living in correctional facilities, homeless shelters, and migrant labor camps who have been have borne the brunt of outbreaks, in addition to those who work in those sites. Frontline essential workers should be prioritized in the order listed in the 1B detail section at the VDH site. So there is an ordering within 1B, and that only makes sense because we have so many folks in 1B. Now, it wasn't originally designed that way. Two things occurred. First, the vaccinating community said in some communities, especially rural areas, 1A, they could get through 1A relatively quickly, and they had doses, and they wanted to move on to 1B. And secondly, the federal government gave guidance that wherever you're at in 1B, you've got to have those 65 and older. We originally had 75 and older, with 65 to 75, and those under 65 with high-risk medical conditions being in 1C. So we took that directive from the federal government, and here we are, so that we need to, as we had designed originally, focus on the prioritization, with now 50% of doses going to those 65 and above and allocated, as I mentioned earlier. So there is simply not enough doses available yet for everyone who is eligible to receive them. And Virginia is not likely to meet the demand for 1B until March or even April. So we have a limited supply, but we're working through as fast as we possibly can. In addition, Governor Northam has extended Executive Order 72 through February 28th, which maintains the 10-person limit on social gatherings and the requirement to wear masks in public places, guidelines for businesses, as well as other provisions. And in a letter to school superintendents on February 5th, Governor Northam indicated that all public school districts in Virginia should resume some in-person instruction options by March 15th of this year, consistent with guidance from the Department of Education. Research by the CDC shows that in-person schools have not been significantly contributors to the transmission of COVID-19 when standard mitigation strategies like masks and physical distancing are used. So children and teachers bring COVID to school. They don't get it generally at school if those mitigation efforts are followed. And that's good that we've confirmed that with research nationally as well as here in Virginia. Now, I'd like to go into some current efforts to ensure that early childhood educators and our child care providers are vaccinated. As soon as we were made aware, and I think the First Lady indicated this, that the categorization of child care providers and K through 12 teachers were not being consistently followed, we took immediate action. I asked Dr. Dana Avula, the state vaccine coordinator, to notify all local health departments that teachers and child care providers should be vaccinated simultaneously. Assistant Secretary of HHR Katie Finley and David Carey, the First Lady's Chief of Staff, have been assisting with collaborative efforts among the Governor's Office, the Virginia Department of Health, localities, DECF, Smart Beginnings, and other organizations to make sure that this is happening. And notes from the field indicate that indeed that is happening, and please continue with your feedback. Later on, you will hear more about the collaboration and how navigators are working with each health department point of contact to ensure that child care personnel and early educators are prioritized for walk-in appointments when supply is available, and that closed points of dispensing events are organized specifically for this early childhood community. I'd like to raise now how safe and important the vaccine is in protecting our communities and getting us back to everyday life. So our health department analysis shows that more COVID-19 cases and deaths occur in areas with higher African-American populations. Black and Hispanic Latinx Americans also face greater economic difficulties during COVID-19. Yet in jurisdictions all over the country, large numbers of African Americans have expressed hesitancy to the government's expectation that Virginians agree to be vaccinated in hopes of controlling the devastating spread of the virus. Now, this reluctance is more than understandable, for it is born of justifiable mistrust of medical experiments that were once implemented in the Black community, using methods that violated the most basic research ethics for conducting experimental trials. Yet the vaccine has been proven to be safe and effective in tens of thousands of Americans from all walks of life. It will greatly reduce our chances of getting COVID-19 and will ensure that if you do get the virus, you will only have mild symptoms or none at all. We don't know yet why some healthy people become seriously ill or die from COVID-19, while other people with COVID-19 only become mildly sick. There's no way to know how COVID-19 will affect you. Once vaccinated, your body will build immunity to the virus, so you're less likely to get sick. The vaccine will not give you COVID-19 because the vaccine is not made from a virus. And the vaccine just teaches your body to build the protein, the antibody that fights the virus. However, it can take a few weeks before the body builds that immunity after any vaccination. So it's possible to get COVID-19 from another person just before or after being vaccinated, and while your immunity is still developing. Sometimes the immune response from a vaccine can cause soreness at the injection site, a fever, headache, or tiredness. That is normal and should go away in a few days. And that really is showing that your body is reacting to the vaccine in a positive way, and that's a signal that your body is indeed beginning the building of immunity. The place to visit is vdh.virginia.gov for more information about the safety of the COVID-19 vaccine, as well as the new call center number, which will be distributed next week. And I will say on a personal note, it was just wonderful to go this past week. Today's Friday, I think on Tuesday, to the Arthur Ashe Center here in Richmond, where I got my final training as a volunteer vaccinator. I'm a physician, a cardiologist who's used to doing thousands of heart procedures, but I also, like everyone else, needed to make sure that I had the best information and training and gone through my modules, and then I needed to be observed while I was doing a vaccination. And it just happened that the 3 people that I vaccinated under supervision on Tuesday, one was an early childhood educator, one was a K through 12 educator, and one was a nurse who was a bit hesitant the first time around, but after observing her friends and thinking it through, came in to be vaccinated. And I just got to tell you how incredibly gratifying it was to see these individuals get the vaccine that we all want. I'll get vaccinated when it's my turn. And to see that, that they were willing to get vaccinated, how excited they were, and how important this was to them, their families, and to the community and all the people that they serve. So before I close, and on behalf of the Northern Administration and the Commonwealth, I want to say thank you. While many people first think of our health system and nurses and doctors, I know that our child care providers and early childhood educators are just as much on the front lines of this crisis. You've been caring for the children of frontline workers all along the way, and how critically important that was and is and will continue to be to help our economy get going and to make sure that services are provided that are critically needed. Because of these efforts and talent and the expertise of everyone on this call, children have been cared for, our economy has been protected, and Virginia's parents have had a safety net. From the bottom of my heart, both as Secretary of Health and Human Resources, but more importantly, as a Virginian and as a father, I say thank you. Thank you for persevering through this crisis. Thank you for showing up even on the days when it seemed too much to bear. And thank you for taking such excellent care of Virginia's children and families. We are not done yet, but with every passing week, we get closer to putting these terrible times in the rearview mirror. I'm here with you, and it's been an honor to join you this morning and be with the impressive individuals such as yourselves and our other speakers. In closing, I just want to remind everyone that it is more important than ever to take the same precautions as always. Staying home when possible, wearing masks when you're out, maintaining physical distance from others, washing your hands and sanitizing frequently, and the other best practices that we know about, but I know I do, need to be reminded of. So thank you, Kathy, for this great opportunity, and thank you all to this wonderful community that's doing so much for so many under challenging circumstances. Thank you so much.
Thank you, Secretary Carey. Really appreciate your comments. And do you have time to answer just a few questions that we've received from our attendees?
Sure. I've got, I think, a couple of minutes. We can take one or two questions.
Perfect. That'd be awesome. You've mentioned a call number, a call center. I think that it's not yet set up. Can you tell us a little bit more about when it will be, and do we know the number yet?
Well, first, the 1-877-ASK-VDH3 will roll to that new number, and that will be announced next. No one has to learn anything different. You just use the number we have, and it's again, we are getting this up now because our smaller call center and all the call centers that our localities have in conjunction or independently from the local health departments has proven simply unable to take care of the increasing demand. So that's why it was clear that we needed to create a safety net source of information, source of pre-registration, and a source for getting appointments for vaccination for all Virginians. Again, adding to the capability of the current call centers that exist. So you'll be able to call that number and talk to a live person, and that will get the best advice based on the CDC and Virginia Department of Health. And then also to gain help if an individual in pre-registering for a vaccination that will go in the queue with their local health department. So we're really excited about the statewide call center that has the capacity to really take care of the demand for information, for pre-registration, and eventually for the scheduling of doses. Once we have enough doses to work through the backlog of those who are already in the queue, and then once we're through that, we can in real time fit people right into schedules as we get doses enough to stand up those large mass vaccination events.
Excellent, thank you. And I see we've dropped that number in the chat for those of you
Great.
who are asking for the Ask VDH. Also, could you just level set for a moment in terms of the length of time it will take to get through this particular phase 1B? I know there's a real frenzy right now, but I expect that it will be at least several weeks. And could you speak a little bit to how long we expect it'll take to get all these folks covered?
Right. Again, remember there's 2 doses, although the J&J that will go before the FDA panel 2 weeks from today or two weeks from yesterday. We're optimistic about that being available. We have not yet heard about the AstraZeneca vaccine and where it will be in the process. So if we have no change in the current doses, 130,000 or so new doses and corresponding second doses, it will take months to get through 1B. But those in the child care community are in those first 3 highest echelon of 1B. So we are very much in the midst of that. But those of us, continuity of government people that are at the bottom of 1B, it could be many months. Now that the variable there is when the federal government gets access to new supplies of either the current vaccines, the Pfizer and the Moderna vaccine, because they are ginning up production, and then the production capacity of the newly approved vaccines. That's the variable in April and May. So it's going to be months in 1B. I think in terms of where teachers and childcare workers are in 1B, that time is now. So we are working through that list. But those on the bottom part of 1B, and I'm in that list, continuity of government people, it could be months down the road.
Okay, thank you very much for that. I'm going to ask you one last question and let you get on to your next appointment. One of our attendees has asked if some of her staff take a pass now because of their hesitancy about the vaccine, would they still be prioritized later or able to get in the queue easily?
Yes. That example of the 1A person that was hesitant, and I think that, I think we understand that this was I think my wife is a nurse. She is working as a nurse, so she is indeed got her first dose, not her second dose, but some of her colleagues are hesitant, and we still want to get them vaccinated. So our policy is that those in previous phases are still eligible. It's not, doors closed, we're pulling up the stairway, you're out forever. I think we want to be inclusive and understand that sometimes it takes a while for an individual to feel comfortable with experience of their loved ones, experience of their colleagues professionally.
Terrific. Secretary Carey, thank you so much. We appreciate your leadership and your advocacy for all Virginians and for this particular workforce. Really appreciate you.
My pleasure. Again, thank you to the whole early childhood community, educators and caregivers, how important you are and all that you've contributed. So thank you so very much. God bless. Bye-bye.
Have a great afternoon. Next, we are going to hear from Dr. Stephanie Crew, who is a physician, as well as Saida Madden Curry, a registered nurse. And they are terrific to be here with us today to give us some perspective from their viewpoints about considering the vaccination and all that needs to go into that. And we'll start with you, Dr. Crew.
Sure. Can everybody hear me? Okay.
Little hard to hear you.
Little hard to hear me. Okay. Let's see if I can correct that. Give me a half a second.
That's better. I think if you lean towards your microphone.
Okay. I switched on my AirPods, but I'm gonna.
Let's speak. Can you hear me now?
Oh, that's terrific. Thank you.
All right. So hi, everybody. As has been stated, my name is Dr. Stephanie Crew. I am an adolescent medicine physician at VCU Health System, and I'm happy to come and speak to you guys today. I was asked to speak on the topic, the general topic area of just considerations. And so as I've been moving through this along with everyone else, certain things have stood out for me in terms of what Dr. Carey mentioned a little earlier today, and that's the big vaccine hesitancy issue, which particularly in the communities in which I serve, that is certainly a big thing that we look at. And so for those that are on this webinar, what I would say in general is that we have to and must acknowledge history, and we must acknowledge truth. We have to and must acknowledge that the medical community as a whole has not consistently been the advocate, the supporter, the encourager, and the protector of Black and Brown communities. We also must acknowledge that trust right now in those same communities are in short supply. In general. Yet we also know that it is that trust, that same trust, that is critical to health in general. It's critical to propelling us in accepting this vaccine. And it's also critical in encouraging certain communities, particularly communities of color, to move us forward and promote optimal protection in general during this pandemic. And lastly, we have to acknowledge the repeated generational trauma that's been imposed by a system that has often relinquished its duties to protect and serve. And so I think it's with that acknowledgement that I have begun to understand that vaccine hesitancy and how we move forward past that in order to get the communities that are affected the most and where the racial disparities are evident, in order for that acceptance to improve over time. There is a New England Journal of Medicine article that I would really suggest that everyone reads. It came out in early 2021, I think January, and it's called Beyond Tuskegee, Vaccine Distrust and Everyday Racism, because racism plays a key role in what we're seeing in terms of vaccine uptake, vaccine hesitancy, and willingness to move forward with that. I think that there are three things that I usually tell people that are in the mode of either waiting or they have substantial hesitancy. And that's one, that I see you, I hear you, and I acknowledge your need for more information. That's what we say every day to those that are still in the hesitancy mode. And I think that that's sort of the recommendation that I would give to everyone in a position of educating the masses in regard to this vaccine. I also will tell those that I'm encouraging, decide really what you're waiting for. Are you afraid of the risk associated with the vaccine, or is it that hesitancy from a historical perspective? Sort of put it on your agenda of deciding, what's the wait for and sort of how long you're willing to wait. And then also decide sort of what parameters are you going to use in order to protect yourself until you deem it okay to get the vaccination. And then the last thing I usually will tell people is be willing to learn, unlearn, and relearn what you've been taught about vaccines in general. I think the previous doctor that was on before me, the Secretary of Health, He did mention a lot about the vaccine in terms of its safety and its efficacy, which we know is true. We know that it's under emergency orders right now, but we are finding that it's a very much a safe vaccine. With very few side effects that are being seen. Those side effects can be muscle soreness. Some people have a little bit of fatigue. Some people have a little bit of chills after they get the vaccine. But for the most part, these are very temporary, and certainly weighing that against the morbidity and mortality of getting the actual disease, that is a very small feat for a day or two, as opposed to, again, the morbidity and mortality associated with getting COVID-19 itself. Another question that I think I was asked to answer is sort of, what does it do? It works to prevent COVID-19 disease, whether that's via, reducing or minimizing symptoms associated with acquisition of it, or actually preventing it. Because some people are in the thought of, if I get the vaccine, can I take off these darn masks and throw them away and then start walking around free? Well, it's not a 100% efficacy vaccine. And so therefore, we still have to use those same parameters: social distancing, mask wearing. We also know that everybody doesn't have it, so everybody isn't protected. And so we have to be still vigilant about what we do after we get both the first and the second dose of the vaccination, because again, it's not 100% efficacy in this vaccination. And then I think the last thing that I think I was asked to address, is it for me? Why should I take it? It is, I think my risk, I'm healthy, I'm a 30, 40, 50-year-old, I'm healthy, I don't take any medications, why should I get it? One, again, it's to protect yourself, and then it's to protect others, okay? The other thing is it reduces significantly the severity associated with acquisition of COVID-19. So those are the two top reasons that I sort of emphasize it, with the understanding, again, that we have to look at history. We must acknowledge that people are fearful, and we must acknowledge the distrust that has happened in certain populations.
Thank you so much, Dr. Crew. I know a number of folks asked again for the name of the article that you referenced, and yes, I believe my team has been able to drop it into the chat box. Just want to make sure that
let me get the name of the author that wrote it. Last name is B-A-J-A-J. First name starts with the S, and it's called Beyond Tuskegee: Vaccine Distrust and Everyday Racism. It's a New England Journal of Medicine article from 2021, January.
Perfect. I think we've got it. Thank you so much. Really appreciate that. And if you have time to stand by and wait just a few more minutes, we'd love to hear from Saida and see if we can answer some of our questions coming in from attendees. Thank you so much. Saida, your turn. Welcome.
Thank you. I guess I will just echo everything that Dr. Crew just said. And thank you guys for all the work that you do. I worked in childcare for some years, and I know that when you're facing a pandemic such as this, working with small children can be challenging, because I was thinking this morning about how touch-oriented they are and how close they need to be at all times. So I am very thankful, because as a nurse, I know many of my colleagues have had to rely heavily on childcare providers right now, because we are being called on to take care of our communities in such a great effort. And I also, just to add to what Dr. Crew said, I just encourage everyone that I speak to about the vaccine to advocate for yourself. Ask as many questions as you feel you need to before making a decision about getting this vaccine, and don't feel like you need to make a decision right away. If you have questions that haven't been answered, seek out those answers, talk to your primary care providers, and look for credible resources. That's something that I've also had to stress a lot. We have a lot of access to information via social media, and that's the main thing that comes to my head. Social media, Facebook, Instagram. And while that can be a good spark for an idea, it's always good to follow up with credible resources when you're making a decision about your health in general, but especially about a vaccine that's so new. And again, yes, if you are part of a community, the African American community, it is daunting to make a decision on something that doesn't have a lot of time behind it. You haven't seen the impacts that it's had on other people. And so there is this mistrust, distrust there in your health, with your healthcare providers at times, because there's not so much backing it in terms of time to see what the results are going to be of this vaccine. So that's the main thing that I would add, is just advocate for yourself. Write your questions down as they come to you, and make sure that you get the answers that you need before making a decision. And don't feel like you don't have the right to ask as many questions as you need to. So.
Thank you so much. It's hard not to get emotional listening to the two of you, and we've had some comments from questioners about the same thing. It just, there's so many things that go into decision making like this, and I'm just compelled by the fact that on the one hand, we have many within this population, this important population of essential workers who are eagerly, attempting to get access to the vaccinations, and because of limited supply, and in some cases because of sort of, stepping out of order of the process that's intended, there are real constraints to actually getting access. And then we have another group who justifiably are hesitant and just are waiting to see what will happen. And I think in addition to the numerous ways that you all have discussed why it's justifiable to have this kind of hesitation or distrust. Also, things like we're seeing questions that we won't be able to answer in this webinar, but folks are saying, should pregnant women, get the vaccination, and what might this do eventually, to fertility? What are ways that, down the road that we probably don't have answers for? One of our attendees said, will this become, mandatory like some vaccinations or immunizations have been, broadly, encouraged or taken up? We just, I think, don't know the answers to all those questions right now. And I think that this underscores that it's perfectly fair to have questions and to pursue education to try to get answers to your questions. And, we just want to promote respect for individual choice, encouragement, lots of discussion about the benefits and the wisdom of vaccination, but also be perfectly understanding and respectful of each person's right and, responsibility of making a decision. Anything that either one of you would like to add to what you've already said in terms of this being such an important and fairly emotional discussion?
Absolutely. So the only piggyback that I would add, check out the VDH. A lot of those questions that were posed are on the VDH frequently asked questions website. So definitely check that out. The fertility question, the a couple of questions that you mentioned definitely are on their website as frequently asked questions. I'll put in a plug for VCU Health. They also have a COVID-19 frequently asked questions, and those questions are definitely available for answering, and you don't have to be a VCU healthcare provider or team member in order to access those COVID-19 frequently asked questions. Go to vcuhealth.org.
Thank you so much. Saida, any last words?
I don't think so. Thank you.
Thank you so much to both of you for being willing to share your perspective, and in some cases, some of your personal stories. Really appreciate it.
Thank you.
Thank you. Now we will move on. We have also a number of questions in the box from folks about if we haven't had luck in our jurisdiction, how can we proceed? So we're going to hear next. And Tiana, if you'll go to the next slide, would love to hear from David Carey and Shekinah Mitchell, who've been sort of a dynamic duo in putting together a collaboration that we think you all will be glad to hear about, and hopefully will be coming soon to a theater near you. So David and Shekinah, take it away.
Thanks, Kathy. As already shared on this webinar, we all desire the best possible outcomes for children, families, and childcare providers across our community. The role providers play as educators and caregivers is woven into the fabric of what makes our society flourish. And I'm going to take the next couple of minutes to talk about collaborative efforts between the health department, VECF, Smart Beginnings, and other early childhood partners. First, I want to acknowledge and affirm that childcare providers are essential workers, and many have remained open during the pandemic to serve families in their community. This reality is why childcare providers have been prioritized as part of Group 1B who are eligible for the vaccine. This reality is also what's motivating a sense of urgency to make sure this eligibility leads to equitable access to vaccinations. As already affirmed during this webinar, access is only one side of the coin. Vaccine hesitancy is also a significant factor and plays a role that cannot be ignored. It is part of the reason why some national estimates put provider vaccination rates at only 30%. And this brings us to our next reality, which is childcare providers need access to factual, unbiased information about the COVID-19 vaccine so they can make informed decisions about what is best for them. The dual reality of the essential role childcare providers play alongside this need for information birthed a new partnership between health and early childhood leaders. We can go to the next slide. So in response, we have partnered to launch hashtag Childcare Strong navigators in every locality in Virginia. This collaboration brings a coordinated effort between health departments and early childhood navigators to streamline inclusion and access for childcare providers. Part of the beauty of the early childhood community is the diversity of settings. This includes home-based, religiously affiliated, unlicensed and licensed, Head Start, VPI, and the list goes on. There are a myriad of childcare professionals working every day to support our youngest Virginians. This diversity means there is no singular voice that represents all providers, which elevates the need for coordination across this diverse landscape. Navigators are community leaders already embedded within the early childhood community, whose role is to support local health departments in reaching our diverse community of providers. This partnership also includes collaborative communication using webinars, briefings, and other communication channels to build awareness around the state. For social media purposes, the hashtag Childcare Strong will help link efforts from rural and mountainous areas to coastal and urban neighborhoods. This partnership is also empowering regional problem solving by connecting local leaders in health and early childhood to share both challenges and opportunities for rapid resolution. Current priorities for the navigators consist of working with health departments to plug in childcare providers within existing vaccination events and planning registration-only events called closed pods or point of distribution specifically for childcare providers. We're tracking these events around the state, and while we ask for your patience as our entire nation is undergoing the largest vaccination effort in our history, we also want you to rest assured that there are folks within the health department, governor's office, and early childhood leaders working vigilantly on your behalf. These folks include First Lady Northam, Secretary Carey, David Carey, Katie Finley, Rachel Becker, and too many early childhood partners to name, who we are incredibly grateful for. Each of them have taken on this additional work on top of already full plates because they want all childcare providers to receive the support they deserve. So collectively, there are now 28 navigators working with 35 health districts covering 133 counties and cities to reach more than 6,000 childcare providers. Assistant Secretary David Carey, we'd love to take the space to hear from you as well.
Sure, thank you, Shekinah. That's fantastic. And I think in addition to the list of folks you mentioned, I think this is a overall, from the governor's office to state agencies, a lot of people behind the scenes that you don't always see have been involved in this. One of them is Dr. Megan Healy, who is actually with us today and will be talking soon, our Chief Workforce Officer. She's been working on this from the workforce angle, Secretary of Education Carney, all the way to Department of Emergency Management and Secretary Brian Moran. They helped with getting the 4,000 push packs of PPE out. The governor's communications team. There's a long list of people that have been involved in this, and I think that's testament to you all's advocacy, the importance of your work, and then this administration trying to sort of across secretaries and agencies put some emphasis and urgency to what we're doing here for the early childhood field. And so just to shout out some folks, and like Dr. Carey said, before vaccines even arrived, the governor, Secretary Carey, Department of Health announced that the early childhood workforce would be part of one of those top essential frontline worker groups. And so that's why when we started to get feedback from you all that this was not happening in the way that we intended locally, I think we were alarmed here. I know Secretary Carey and his team, there's no hesitancy. They said, of course, that's not the way it should go. We shouldn't be giving, only K-12 teachers or only, other teachers from this group. We very clearly said that this was for public and private early childhood, pre-K, K-12 teachers. And so that's, guidance was sent back down, reiterating to them, like Dr. Carey said, that folks need to be seen at the same time. And this is sort of in line with our shift during this administration from considering early childhood not just as separate or babysitting or whatever folks may have said in previous years and generations, but this is part of the early learning is part of the spectrum of learning from age 0 to grade 12 and higher education and beyond. And that's why starting July 1st, our Department of Education will be overseeing all of the federal block grant dollars, Head Start, all of those VPI, the pre-K programs, everything in one place. And I think including you all on the same level with the K-12 teachers and it's been exactly what we intended to do. I think we started this local navigator system, like Shekinah said, because no one knows your community like you. I think that these health districts, in talking to some folks at some point about things that were going wrong or things we needed to improve, they said back to me, well, sorry, this is my first pandemic. And it's funny, but it's also true. It's frustrating. I get frustrated almost every day at a different aspect of this, but these local health districts that were set up in the way they are, the local school divisions, the state VDH, none of this was built with the understanding that one day we would be needing to get out millions of dollars of PPE, millions of COVID tests, millions of COVID vaccines in a matter of months. So we're essentially building the ship as we fly it, so to speak. And there have been, as Kathy said, bumps in the road, but I think I'm really optimistic about where we're going with this, and thanks to you all being part of that. So I'll also say that you all have really stepped up. Virginia's economy has been an anomaly here. Obviously, things are not good right now. A lot of people are hurting, but there are one, maybe two states other than Virginia that have not cut their base budgets and that are not in deep declining recessions right now. And part of that, like the governor said, is because of you all, like the First Lady said, over 84% of our centers are open right now. You all have been working through the pandemic. That allows other essential workers to go to work, to continue to grow out of this pandemic. And that is invaluable. That's credit to you. And as the governor said when he talked about setting a goal of having in-person learning opportunities at all school divisions by March 15th, he cited the work you all have done in keeping rates low as the reason that as an example of how in-person education can be done safely if the right guidelines are followed. And that's all thanks to you. Also, obviously, this is not just about the economy. I think we're all have been very concerned about the record drop-offs and literacy skills and social emotional learning that have been happening with our kindergartners. Right now, we're in the General Assembly session and have been talking to legislators about this. They are concerned. They've been putting new resources toward early childhood education, and the governor will be announcing in the next few months more federal aid that is available to the field, because we all know you are on the front line of recovering from this learning loss that we've had from COVID-19, especially with our most vulnerable and underserved children. And so we can't get out of this, we can't recover from this pandemic without you. I think we're already recovering because of you, and that's extremely important. And finally, as the First Lady mentioned, she definitely wants to get back out there. She's traveled over 6,000 miles and seen many of you in your centers and your homes and your locations around the Commonwealth, and looks forward to getting back. We hope to visit some vaccination events. Like Shekinah said, there are over 6,000 different providers that are licensed in Virginia. That means over 57,000 employees in the early childhood workforce, not even counting the VPI teachers, the pre-K teachers that are in school divisions. That's counting folks just outside of there. So we look forward to seeing as many of you as we possibly can as it becomes safe to do so, and as we travel around. And to reiterate what Dr. Carey said, I know it can be frustrating. We feel frustrated all the time, for folks who haven't heard anything yet. But to reiterate that number of 57,000 people just in center settings and family day homes together, not to mention the hundreds of thousands of educators in other private schools and public K-12 programs. So this is going to take up to a couple months potentially, like Dr. Carey said, and folks are already getting in. More folks are scheduled in the coming days, we're working through folks and ask for as much patience as possible, but you're completely right to feel that urgency and frustration that you feel. We certainly can't imagine. So that's what I've gotten, and I think we're both happy to take some questions if there are some.
Thanks to both of you, Shekinah and David. Appreciate all the information. And I think what I'd love to do, David, is ask you to just state again, or give folks a sense of when this process of doing the collaboration and having each health director reach out to the navigator and begin to plan some of these either walk on or closed pod events, I think would be helpful for folks to understand just how recent and how new this initiative is. Enthusiastic, but fairly new. And so if they've had challenges in the past, I just want to kind of give them renewed hope that things hopefully will be smoother in the future.
Sure. So yeah, and to give some perspective, less than 2 months ago, Virginia had not even received the first vaccine yet. This is brand new in terms of the distribution of these. They went first very quickly to the folks who are literally working with folks who are COVID positive in the hospitals, the doctors, staff, nurses, everyone involved there. And then in recent weeks, I believe it was just this month approximately that we even got to phase 1B, work through the fire EMS folks, and then it's just in the past days, 2 weeks or so that folks have gotten onto this category that you all are in with teachers. So this is very new, and right when we got to 1B is when we first heard some of the initial concerns. For example, a health district that had obviously for a health district, if they have thousands of shots and they need to get them out right away, they can call the county superintendent of schools, and they've got thousands of teachers that can schedule immediately. Obviously, you all know the way this system is set up, that same county may have 300 or 400 different centers that all have thousands of employees spread out. So one phone call can get a line of pre-K through 12 teachers in. It's going to take 350 or so calls to get anywhere close to that. So what folks were doing inadvertently, with no ill will, was scheduling what seemed the easiest and quickest way to get vaccines out. And Dr. Carey and folks here in Richmond had to say, we understand that, but no, these need to be open events to everyone who's teaching any child age 0+. And so that's how that happened. But that happened in just the past 2 weeks, I believe, Kathy. And I think this week right now is, I believe, the first full week that we've even been doing this Navigator program. So I know some folks are just now making these connections. So that's a good point to point out that this is very much ongoing and very new. We scheduled this update for you all the moment we had a plan in place, but this is by no means a long-term effort that's close to done, by the way. We're just scratching the surface and getting folks in. And Shekinah said, to your point also, Kathy, that there won't be one big event with 57,000 of us all lined up to get our shots and it's done. I think there are some events planned that are coming up in the coming weeks where it'll be, one place, one time, and folks can show up and get their vaccines from the early childhood and education world. But a lot of health districts, we know in Prince William and I believe in Fairfax and Hampton Roads and Chesterfield, basically every time they get 1, 2, 3, maybe 5 extra shots, they make a call to their navigator and say, who can get here the quickest? Who do you know who needs a shot? Who do you know who is most at risk? And so there are big events coming, but there's also every day there are folks, getting in just every bit that we can. So that's another thing to be aware of, is there may come a time when you get a call with a fairly short notice to get a shot, and that's not done out of a lack of organization. That's done out of, these shots have limited shelf lives, and rather than let a single shot expire, we're going to call a frontline worker like you all to come in and get it as soon as possible when that happens. So, yeah.
Thank you. And Shekinah, let me turn to you with this. I think some folks are also a little, wanting to make sure, should they be waiting for a call? Should they be, calling in? So I think, walking through what individuals should be doing in terms of signing up on the VDH side or on their local health department side. Their first point of contact is still probably their local health department. But could you talk a little bit more, Shekinah, about how folks can feel like they're seen and, what's the process from there?
Sure, no problem, Kathy. So the Navigators Initiative is not intended to create a new system of registration or like a new pathway for vaccinations. Instead, the Navigators Initiative is being put in place to support existing infrastructure, and then to say, on top of this foundation, how can we add additional events to make sure providers gain access to the vaccine? So what that means is, in the meantime, you should still go through your local health department, make sure you are registered, and use the existing pathways to access the vaccine. It is when there are challenges with those pathways, and again, also making sure we have specific events for childcare providers where the navigators will be stepping in. So again, for now, continue to go through your local health department, continue to get registered that way. And we will be using social media, like check the hashtag ChildcareStrong. We'll be sharing information. And again, your navigators will be kind of working behind the scenes with your health departments to make sure providers have access.
Terrific. And some folks have noted, challenges they're having in their particular jurisdiction. And I would say, continue to reach out to your health department, but I think we can also use the information that we've been provided to make sure that those connections are being made in each of those jurisdictions, to make sure that there is a contact at the health department and a navigator actively working on ensuring that there are plans as soon as supply is more, robust, for those closed pod events, large events where we can bring a lot of folks in and do it at a time when childcare providers and early educators can actually get there. But also we want to continue this process of whenever there are some slots that we can grab, we want to make sure and do that. We understand that's not particularly convenient and may not work for some, but in terms of like calling down the list and just making sure we can make use of every single vaccination, they're just two paths there that we're trying to follow. Anything more, David or Shekinah, you want to add to that?
I think I would say also that this is, the state is not currently only vaccinating educators right now. The folks that were previously available, so that's the doctors, anyone associated to medical staff, people who are working in senior living facilities, for example, in residential facilities are eligible, and everyone 65 and up are people with significant medical complications age 16 to 64. So that is literally several million people in Virginia that are eligible right now for shots. And the governor last month said that we had a goal of getting I think over 250,000 shots by in the coming weeks. We've now, I think a week ago, passed 1 million. So the number of people getting in is large, but at the same time, this pool is large right now. So I want to reiterate that if you haven't heard something, it is not because you've been skipped. It's not because folks are unaware of you. It's not because of a problem. I think this is something that's just going to take a little bit of time. And we also want to reiterate that, like Dr. Carey said, we will be on, he expects right now on phase 1B for up to 2 months or so into the spring, which means we are not going to skip this group and move on. To someone's question earlier about if I don't get it now, is that it for me? That's not the case. And I mean, the number of vaccines we're getting is slowly increasing every day. Obviously, if you haven't gotten one yet, it's hard to feel that or to internalize that. But the new administration, the Biden administration in DC has been a great help in increasing this. The companies that are making the shots are slowly realizing that they can find new ways to innovate and make this faster. So new companies are coming online with shots soon. So there are a lot of reasons to have some hope coming up. But if you haven't heard anything yet, just want to remind everyone that is not because there's a problem.
And then
I'll just go ahead, Kathy.
You go, Shekinah. Let's hear from you.
No, I was just going to say, I want to say thank you and really honor, I think, the voices of childcare providers. We didn't include this in the presentation, but it was essentially the stories of childcare providers who were running into challenges or who had questions that shared that with their networks, that then shared that with VECF, which then triggered more conversations at the state level that has led to this Navigators program. So your voice matters, and the experience and the stories that you guys have been telling, like this is a result of that. So continue to use your voice, continue to share what's happening, and we'll continue to respond as best we can.
Thank you. And a question that's come forward that I think is a really valid question, and I'll just see if either one of you would like to take a shot at answering this. Should a center director be registering and sort of advocating for her full staff team, or should the staff individually be registering and signing up and trying to access vaccinations?
Yeah, I would say that the best situation is to limit the amount of volume of calls and questions into a local health district that is receiving thousands, tens of thousands of these maybe on a day. If one person can be speaking for the group of whether that's 5, 10, 20 employees, that's very helpful for them. That's an easier way to have one point of contact to work together. So I would definitely suggest that. Potentially one exception, and if we can clarify this if any of the folks from the VDH team or others are on right now, is that if you have individual employees that maybe are at a higher risk, let's say they're over 65 and they have a heart condition, they're a transplant recipient, there's any one of those folks that are listed, you can see on the CDC and the VDH websites the list of highest risk individuals. Those folks, when possible, are eligible and sometimes might be able to get in quicker. I know that in some regions, they've had days where, for example, the VCU health system had, I think, 6,000 or 7,000 additional shots that were soon to expire. And so what they did was had an event for people over 65 only. So there's sometimes opportunities where if you have an employee that falls into a significant other risk group, it might make sense for them to go to an event like that or to sign up individually. But for the most part, that's a good question. And I mean, obviously, Shekinah's heard more from the Navigators. I would turn to her, but I think it's best to have one person advocating for a group.
Yeah, and I'll affirm what David shared. The only other caveat that I'd add is even with a director advocating for their staff and like going through that process, when it comes to actually scheduling vaccinations or finding those appointments, prioritize, as David shared. And you'll also want to consider staggering your staff. As we heard from Dr. Carey and Dr. Crew, RN Saida, sometimes there are side effects, right? So, and it may be a day or two where someone may have a fever or are feeling ill and may not come to work. And you don't want to be in a situation where all of your staff got their vaccination all at the same time and then they all need a day in order to recover. So to just think thoughtfully about staggering when the vaccinations happen so that it doesn't compromise your operations.
Thank you. And Shekinah, I'm going to ask you the last question before we move on to our next presenters, and y'all can have a moment of relief. We also have had some questions about, is there a Facebook page for hashtag Childcare Strong? And wondering about, in addition to, you know, kind of using that hashtag and getting sort of social media going about it, it may be a really good idea in terms of having a centralized spot where folks can learn about what's going on, where there may be events coming up. Might be a really great idea, and just will ask you to address that.
Yeah, appreciate that suggestion. So what I'll say is that the navigators and those connected with the Navigator Initiative are meeting every single Monday. And so we'll be together literally in like a couple of days, and I'll bring that forward to our group. I think it's a fantastic suggestion, and we've got folks like Karen and Tiana within VECF who are wonderful. So yeah, we'll bring that to the group, add that to our agenda, and see if we can make that happen.
Thank you very much. And I just want to sort of put some words to a number of comments in the link that we certainly understand that, especially for family day homes or family childcare providers, where there aren't lots of adults who can take over, so that a provider can cash out and get a last minute inoculation or vaccination. I think that we are certainly aware of that and looking forward to planning large events or making opportunities that are not part of sort of the typical workday where these individuals can get access. With that, just want to thank both of you for all you're doing and appreciate very much the effort that is, truly top down, bottom up, all the way around, trying to make resolve a problem that is incredibly important. Any final words, David or Shekinah?
I'll just say thank you. I mean, a lot of the folks here have been, for the folks who are working in the field, whether you've been vaccinated or not, thank you for everything you're doing. And for the folks who have stepped up to help with this effort, we greatly appreciate it.
Amen. Thank you so much. Thanks to both of you. And next, we are going to have some conversation about how employers can consider decision-making around the vaccination. A lot of folks have said, will it be mandated? Can I mandate it for my staff team? And first up is Megan Healy, the Governor's Chief Workforce Advisor, and she is here with us today. So appreciate your joining, Megan, to give a little perspective from the Governor's office and the perspective at the state level.
Sorry, can you guys hear me? I had a mute issue. So good morning, everyone, and thanks so much, Kathy, for having me. Fantastic panel so far. I want to reiterate what Assistant Secretary David Carey said about the Governor's Office team. We work very closely together. We think about you guys all the time, especially Assistant Secretary Carey, David Carey, as well as the First Lady. They're always thinking about our children first and thinking about how can we better support you to support our children. So it's really important. Last night, I have a 3-year-old. She'll be 4 in 2 weeks, and she reminds me that every single day. We spent an hour doing Valentines. We drew pictures on every single Valentine, from monsters to princesses to even her teacher. She drew a bust with a backpack. I'm not sure what that was, but she was excited about that. So I really appreciate all that you do. I got that text message last night about our Child Development Center not opening to 9. And then I got the text message saying, nope, it's now 10 o'clock. And then I was waiting for that text message to say, no Valentine's Day party today. We did get that text message, and I didn't know how to address that with my 3-year-old, that she was not going to have a Valentine's Day party. So I told her softly and I said, you know, all your friends might not be there because of the snow. And I was ready for tears. But she just looked right at me and said, Mommy, does that mean I can eat all those lollipops I was going to give my friends? And so we are happy in our household now, and my daughter is also at her child development center. So I appreciate all that you do every single day. So a little bit in my role, specifically during this pandemic, you're probably like, oh, here she is. This is the labor lawyer who tells us what we can and cannot do. I am not a lawyer. I definitely could probably play one on TV because I know I read labor law every single day, if it's from federal law to our state law. We don't have a lot of state labor law, not even protections for workers. But a couple questions I get every day that I'm going to go over. We are making FAQ for specifically childcare providers as well as employers. And so a lot of the questions will be the same. So if you have any questions at all, please email them to me so I can add them to the FAQ. I told Kathy we can work on one specifically to you. The top questions I get, I'm just going to answer really quickly, is the first one: can we make it mandatory for our employees to be vaccinated? So you're not gonna like my answers. You're not thinking of lawyer answers. You're probably thinking they're politician answers, because the answers are actually pretty gray. So currently, what we see is specifically in our health systems and our healthcare, they do have mandatory vaccinations on the flu shots, right? The flu shot actually came out in the late 1960s. It is fully FDA approved. We know after years and years of research and study that it is a safe vaccine. So we do have some employers, only specifically health systems, that require vaccination. And some health systems, you do not get fired if you do not take the vaccination. You just cannot be on the front lines of an ICU. You have to double mask. You have to always wear a mask, and you have to really stay away with anyone with flu. So there's different alternatives. We have another health system who tells me they probably fire about 15 out of their 16,000 employees a year for not getting the flu vaccine. But really, when we think about this COVID vaccine, right, it has not been around as long as the flu vaccine. It is still emergency approval from FDA. So there's considered risks. And we also are looking at our health systems that are not requiring the COVID-19 vaccine. So when we do our Department of Labor industry standards for safety and health codes of our workers, the very, very high risk of anyone getting COVID is our healthcare workers, and they are not requiring the vaccine. So you can say, well, can we still? So we are an at-will state. That means you can pretty much fire any worker for any reason. There's only a couple reasons that you can't, usually around discrimination, specifically EEOC language, sometimes around retaliations and wages and that kind of work. But so basically, there is a law that says anyone is at will. But there's also the National Labor Relations Act, which says that if any worker feels threatened at work or is doing a job to threaten others or themselves, that they do not have to do that work. And so we have not seen these go through the courts yet to know what it is, but I would just say that the worker does have a right in the situation because they could see the vaccine as a threat because it's emergency approval. So our recommendation is not to make this as mandatory. As you've heard, we are working round the clock to make sure everyone has access to this vaccine, so no employer will ever have to make that decision about letting someone go due to not getting vaccinated. The other questions is, can I ask my employees if they've been vaccinated? And the question is yes, because it can be job related. The questions you cannot ask are, why did you not get vaccinated? Because that opens up a window for ADA. So if someone has a pre-existing health condition or health condition that they do not feel comfortable with getting the vaccine, they cannot disclose that to an employer. So you can't ask that question, but you can ask, have you been vaccinated? And we know a lot of our school systems we are, because we're trying to, specifically our teachers count the percentage of teachers that are getting vaccinated. So you can ask that question. Another question I do get is, can I change someone's job role if they choose not to get vaccinated? And so this is a question, if they are on the front line as a teacher, can they move and do they work in the office, or what level of accommodations do I have to provide? We don't recommend changing any job role. if that is the case, then you have to make sure that the terms and compensation of their employment is exactly the same, because if they are not getting vaccinated, that can run into an ADA compliant issue, that they have a health condition that there's concern about, and you have to make reasonable accommodations, and that is in EEOC language, as well as Virginia Disabilities Act is what those accommodations are. But again, terms and conditions of employment cannot be changed, or any type of discrimination on that. So those are my three big questions I pretty much get every day. Again, please email me, or you can email workforce@governor.virginia.gov if you have additional questions, and we'll put them all in an FAQ and send them. We'll be posting the employer FAQ on VDH next week, as well as we'll be sending out the specific one for child care providers probably out next week as well, with a lot of the same questions.
Megan, thank you as always. Such great information and timely, and I think that goes a long way to answering many of the questions that I've been getting on a frequent basis. So thank you so much for that clarity about where there is gray area and what the recommendations are for how to proceed. Really appreciate it. And I see our time is getting short. We have about 10 minutes left, and still want to hear from a couple of childcare employers who are able to share with us today how they've approached this issue and some of these questions. We're going to hear first from Angela Rouse, who's the Executive Director of the Roberta Webb Child Care Center. Have to give a shout out to her because she recently won an award for being the top business person of the year in her region and her community. So congratulations to you, Angela, and we'd love to hear from you.
Thank you so much. I do not know how to make myself appear in picture, so hopefully you can hear my voice. Can you hear me?
We sure can.
Okay, thank you so much. So first of all, I appreciate being able to be a part of this panel this morning on behalf of Child Care Center directors here in Virginia. I need to say, you know, this call has been a little heavy, and too, my heart is really burdened in that there are so many huge decisions to be made, and 2020 has laid a lot on us as providers. And I think after hearing everyone, you know, give us great accolade and appreciative that we've been here to do the hard work, I'm just going to say right now, as a director, I feel as though I am dragging along some real heavy weights, and there have been a few answers to many questions today that will help alleviate, but I think it's really hard for us to make these decisions because of all of the sort of tragic things that we've been through in the last year since March. It's hard to hear, and it's hard to really be clear as to how to move forward. Some of the things that I know are concerns for me as my staff comes to me wanting answers and have been in the trenches with me. I don't have anything concrete to give them, and it's really difficult for us to be able to move forward and encourage and motivate and push people in a direction of bringing a clear climate to the classroom where children can be encouraged to do the right thing when we're not doing really a good job of being able to assure them. So that's a great burden for us as a director. Also, as Megan was talking, one of the things that keeps coming up for us is the confidentiality between even our parents wanting to know if our teachers have already been vaccinated or not. Between coworker to coworker, just so many things are going on, and I feel like where we did have some support just within our own silos, those are sort of falling apart again because we're tired and we're weary, and we just need some things that are concrete for us. And you know, it's difficult because when we all try and pull together as providers, the one thing that we really want is just see us, hear us, and know that we are certainly willing to do the great job that is in us to do. And I know that there's no magic answer. Nobody has a magic wand that they can sprinkle out and all the answers are right there. But when we do reach out, things like this are so necessary for us to be able to gather together, all hear the same things, and be able to make concrete decisions on our own and then collectively together as to what's best for our children here in Virginia. So again, I am very appreciative. We do want to be able to say out loud, we are willing. We just really need to know where to go and how to make sure that our voices are heard, that we want to be safe and we want to be able to obtain that vaccine to make sure that we're here tomorrow when our children and our families need us. Again, remember, we're working at half capacity. We have half the children in our centers that need our care. So we want to be able to go back to full capacity to serve more families. So I know our time here is short, but again, thank you for this opportunity.
Thank you so much. Well said. Shaki, we're going to let you bring us home now.
Thank you, Kathy, and thank you for inviting us to just to kind of share our experience. We've been working over the last couple of weeks, with our community to make the vaccine accessible to our team. We have over 300 employees just with our program, but standing in solidarity with all of the Head Start programs in Virginia, as well as our childcare and private day home providers. And just a couple of points that I just want to make is that the first thing we wanted to do was to collaborate with our community leaders who are now our navigators, like Smart Beginnings and the health department, to coordinate the equitable access for our employees because they didn't know where to go and who to talk to and how to get answers. So we wanted to provide that point of contact for them so that they can have some support and we can try to get as many answers as we could. Secondly, we wanted to make sure, as I already mentioned in the presentation today, that they had trusted information and resources so that they can make an informed decision. I don't have to go into all of the reasons why there are trust issues. We've heard that already today. But we want to make sure that as they make the decision to either get the vaccine or not, that they're making it based on valid information and making an informed decision. And we want to also, as employers, respect their decision. Whatever the reason may be, whether it's for health or religious purposes, we want to make sure that we are still supporting them and making sure that we are providing the same access to PPE as they continue to work on the front line, whether they have the vaccine or not. And then lastly, for those employees that made the decision to get the vaccine, we have several of our staff that received the first dose and are waiting for the second dose. But our executive team took that first dose with them to let them know that we are in support also, and that we think it's equally important, and we're jumping in with them. And so we want to be able to, as employers, to support our employees. We're supporting them with the paid time off to go get the vaccine and an expectation with the second dose, and having any possible side effects for the following 24 hours, also supporting them with that time as well. And so I think that's important too in the decision-making process for our employees in deciding whether they're going to move forward or not, to really know that they have the support of their employer, rather they make the decision to get the vaccine or not. But we are continuing to push all of the resources that we have access to. We're continuing to push that to our staff. Again, we have majority of our employers are African American, and so we want to make sure that we are getting them the education that they need to help answer some of the questions that they have. Now, squeeze that in.
Thank you so much, Shaki. Really appreciate your thoughts as well. So important to understand all of the thought and care that's going into this. This is yet another part of the, the pandemic adventure, that we're all on together. And, while it's, been another bumpy ride, I'm just so optimistic that we'll be able to together with this collaboration and recognizing that how much we benefit from the feedback from providers and what they're experiencing on the ground, kind of, you know, elevates up and gets the attention of those who can help make, you know, resolve some of the issues. And appreciate again the thought and the care that's gone into the comments that folks have made today to grapple with this sort of the tension that we're experiencing. Just want to, you know, go through and thank again our wonderful speakers, First Lady Pamela Northam, Secretary Carey, Dr. Stephanie Crew, Saida Madden Curry, David Carey, Shekinah Mitchell, Megan Healy, Angela Rouse, and Shaiki Franklin. Thanks to all of you. Thanks to the attendees who have spent time with us this morning, and we look forward to providing more information and hopefully resources in the future. Hope everybody has a great Friday.